Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that remote. This is one of my most important shows of the year. Now, you call your uncle, your aunt, your mom, your gumbadis and gumbadis. Get everybody, come to the TV, okay, and watch this show. And this month is Heart Month, okay? So much about the heart. You know, when they play the Star Spangled Banner national anthem, you put your hand over your heart. When the parade going by and an American flag is passing, you put your hand at your heart. And so the heart is so important. You know, it keeps boop, 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 keeps going. And my guest today, we're going to talk about the heart, okay? And I can say that I know a little bit about it because I have a pacemaker over here. I used to be over here, but over here. But that's like a guy, he said they had a nose job. He says it used to be over here, now it's here. But there's so many songs that are written about the heart, okay? Let me call you sweetheart. I left my heart in San Francisco. Peg of my heart. Achy. So all these songs about the heart, you know? And I did a little research on it. But, you know, there's no songs in all the Christmas carols. It's nothing about the heart because it's about the soul in Christmas. So, without all further delay, we got 15-round fighters, you know, right here, top shelf. My doctor, Dr. Belasco, who I had a hip operation, and they told me my heart was going boop, 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 boop. It wasn't going fast enough. And after the operation, they told me I had to get a pacemaker. And he leaned over and says, I think you better, it'll help you, Hank. I said, okay, Doc. So, welcome to the Hank Cisco Show. Now, you take over. Tell me what this show's all about.
Primarily for this show, I wanted to have all of what we now have available from a cardiology standpoint in Norristown. I've been practicing in Norristown for 34 years, and although the last 10 years to maybe 15 years we've had cardiac intervention with angioplasty and been able to treat our heart attacks with emergency angioplasties and stents, we didn't have open heart surgery and we didn't have some of the other things that are currently available. Now with Einstein having partnered with Montgomery and basically building the new hospital, which is on Germantown Pike, we have basically everything that we need in Norristown. There's virtually nothing we would have to refer a patient out of Norristown for cardiology other than maybe transplant at this time. We have all of the non-invasives that we've previously had with cardiology, which Dr. McGargy is going to talk about. We have some additional modalities which he can do, which we didn't have before. We have electrophysiology things which we're not going to talk about today, such as defibrillators and ablations. And the big prize of all is we have Dr. Anderson. We now have world-class heart surgery right here in Norristown for our community. So I'm going to let them discuss their specialties.
Let me say something about Dr. Anderson, okay? Dr. Anderson is a heart surgeon, okay? He's the one that, I was talking to another doctor that does operations to the veins and all, and he says, you know, heart doctors are special people. I guess there's something like test pilots in a plane, everything has got to be right, and sometimes they can be a little cranky because do this, do that, and make sure everything is on the ball. So I would say that a heart surgeon is a special person, and I have to congratulate you or I would have bowed to you, whatever. I'd say that we need people like you. So, okay, now, I just want to throw that in there, ladies and gentlemen, let you know how important the heart, because what good's a car without a motor? Go ahead.
Well, I thank you very much. That's very kind of you. But I think that physicians in general are special people. Most of us now are doing this because we really like what we do. We care about what we do, and it's really our lives that we made a decision about doing this a long time ago. So maybe not just heart surgeons or cardiologists, but I think all physicians are the same. But yes, heart surgery and interventional cardiology can be, you can be in a life and death situation. And
let me ask you one thing. When you have to operate on the heart, do you stop the heart? Tell me.
Sometimes we do. Sometimes, actually, the heart-lung machine was created a long time ago. Interestingly, the first heart-lung machine was another human being. but where a mother and a child were able to utilize their circulations, or the mother's circulation for the child, in what was known as cross circulation, to in essence function as the heart-lung machine. But then mechanical devices were developed, and over the past 50 years we've developed a machine now that is able to support the heart and lungs and your physiology for hours.
While you're operating.
Mm-hmm.
Oh my God. But now, there's a difference between transplant and a heart operation. What's the scoop on that?
Well, transplantation is now reserved for patients with end-stage heart failure that are, there's nothing more that Dr. McGargy could do, or I can do, or Dr. Belasco can do to make them better or get them out of heart failure such that they can function without significant limitations. So the only way to get their circulation back to normal would be to replace the heart. So in that setting, when a donor heart becomes available and the patient has been seen and entered into a transplant program, and then the donor heart becomes available, the whole native heart is removed and a new one put in.
Yeah, well, I have my son-in-law's father had transplant, but in Philadelphia, but he was in Montgomery Hospital. They took him to Philly to do it, and 15 years. He just passed away just about a year ago, and that was 15 years ago, and he lasted. And now, 15 years later, there's a lot more advancement, right?
Yes,
what are some of the
there
things
is.
up front?
Well,
I want people to feel that, hey,
well, heart transplantation.
there's help out there.
Heart transplantation is still the gold standard, the best therapy we have for end-stage heart failure. However, there are some new therapies that are coming down the line where the results are starting to become equivalent with transplantation, and primarily that is the mechanical circulatory devices that have been developed, which are basically pumps, mechanical pumps that are able to circulate the blood, and now are very small, very durable, can last for years and years, and the big bonus is that you don't have to take all the medicines that you have to take for transplant to prevent rejection. With the mechanical pumps, you don't have to take any of those, maybe some blood thinners, but when you look at the side effects of the two, the immunosuppression drugs by far are have a much more significant side effect profile. So, and mechanical devices are readily available. Yeah. So it's going to be a change with respect to how we manage this.
Not all operations are cutting open. I guess this is where you could come in, right? Where they don't necessarily have to cut you open. They find other ways. Show me some little stuff that they go and find its way through there.
My role between
Suez Canal.
My role between Dr. Belasco and
yeah,
Dr.
that's.
Anderson,
In other words, he's a lookout. He's the lookout man. He sees to make sure that there's something there, and then needs investigation and needs an operation or whatever.
Yeah,
we're so both 1, 2, 3, right?
We're both technical support for Dr. Belasco and the rest of our partners at the hospital.
Well, what is it? Is this a team?
It's a team approach.
Oh, well, tell me that. How's it start?
So it starts with a patient seeing Dr. Belasco in the office for a problem, say chest,
like me.
Yeah, chest
I went
pains,
there. Right.
Chest pain, shortness of breath, and then heart testing's done, an echogram, maybe a stress test, and if that came back unusual or abnormal, then on occasion the next test is ordered, and that's what I do, and that's the heart catheterization.
And I hear so much about the catheter. Tell me what that
the catheterization, years ago, we would only go in the leg to do it, get back to the heart through the leg blood vessel. These days, we now, more than half the time, are able to go in right here with a little tiny catheter and go back around to your heart.
And it's all the way up to your heart.
And through that little opening, we can fix blockages with balloons or stents. And I have brought some samples for you.
Well, let me see.
Okay.
You know, we got to get there.
So the first sample
I hear the stents. You know, I don't know what it is. Tell me, ladies and gentlemen, this is educational.
So
and we're making home visits. You know, doctors don't come to your house, but we're coming in your house now.
So if somebody has a blockage that is to this degree, which
Oh, that,
That
okay.
is a pretty severely blocked artery. And the yellow stuff is plaque and cholesterol and fat clogging up the artery.
In other words, the blood has to go through here.
Yeah,
And-
through that real narrow opening, when in the past,
But that's what it's supposed to look like.
it's supposed to look like this one, with a real big
Oh,
opening.
my God, yeah, okay.
So, you know,
Can
if
you get a good shot on that? In other words, this right here,
that's a normal looking
and
artery.
over here, can't get through.
And
So,
then on this one, this is a
and that's
really
more, right?
blocked artery.
Nothing.
So if an artery is blocked like that, we can normally fix it with a balloon to open it.
What do you open, like here?
Yes, we go through the middle with a small wire, over the wire, slide a balloon.
You got that wire with you?
I have something like the wire. I'll show you
Okay.
that one in a minute. And then after that, we are able to actually place a little metal spring called a stent,
Can I
which
get
you
a
can
shot
see
on that?
there. You can see
That is what you call,
that's a stent.
and that's placed in there, the whole glass thing here?
No, just the little metal piece in the middle.
Oh,
The little metal spring in the
oh,
middle.
Okay.
Yeah.
Oh, I see. It's like a little spring.
Yeah, Chinese finger slinky kind of thing.
How about that? Yeah.
And those we place in the heart for blockage, to open the blockage and keep it open. And then that stays in the person's heart to keep the pipe open.
That's small.
That's small, 2 millimeters to 4 millimeters, so real tiny. And then if a person is had blockage, hardening of the arteries for a long time, there's a tiny device called a roto, which is a high-speed drill.
Hey, whoa, roto, what do you mean? My sewers clogs up out front.
It's just a
Roto-rooter.
small roto-rooter, and this we use to clean out the inside of the pipe to open a larger channel to make it easier to put the little metal stent in. So we have all
God.
kinds of tools now.
That is round. It's almost like a lady's thing when she
A
puts it
curler?
on her hair.
Curler,
What do they
yeah.
call that?
A
Something.
curler?
Yeah. And that keeps people alive.
Keeps people alive. It prevents heart attacks
You put this in without the big cutting open?
without cutting open. Just a little tiny needle puncture is all you need through here, or sometimes through the leg artery.
Whatever. If the person is heavy set or so, it becomes a problem. That's why you want to keep your.
If it's a heavy-set person, often it's easier to go in through the wrist.
Okay, I see. Yeah.
Yeah.
I can say that.
The arteries we're talking about are these coronary arteries that are on the outside of the heart, and they feed the heart muscle so it can keep beating. Those are called coronaries. And the arteries where Dr. McGarty's talking about placing the interventions, the balloons to dilate them open, and stents or a router to open up a completely blocked artery. And then Dr. Anderson also has a number of techniques.
Yes, if
involving this same
a
thing.
person is too sick for me to fix and they have so much blockage that I can't do it, then I call Dr. Anderson, who actually, he works right next to
Come in
me.
the bullpen.
He works
He's a relief pitcher.
right across the hall, and I'll walk across the hall and find him.
But you keep, in other words, if you go into this procedure, you keep him alert just in case.
Yes,
It's a time
standby.
frame here.
Standby. He's on
Stand by.
standby just in case.